for helping bring us to this, QI training. I know I'm not your friend right now since I stand between you and lunch, but I would like to keep this very brief. And at the end of this talk, I hope that I would show you something similar that you have in your places, and that I would strike some kind of collaboration in the future to work with us, okay? So I would first begin by telling you a little bit about Ethiopia and the problem that we face generally as a country, and then I would follow to the specific parts of the AAU or specifically the medical school, okay? So has anybody, aside from Ethiopia, has anybody had our traditional dish? Oh, that's nice. So I'm a personal fan of injera, and this is our traditional food. It's very delicious. I would recommend it to everybody. And it works whether you're a vegetarian or you eat meat. So I think, I don't know, when you go back home or if you have a place nearby, I would recommend that you try it. We have also a very rich culture, which begins way back. And the picture that you see on that side, this one, is one of the oldest palaces that we have in the northern part of the country. Ethiopia, we have around 94 million population. And the hospital that I'm going to show you next, Black Line, it serves that population. It's basically where you go, whether you're from the northern, the southern, or the western part of Ethiopia. You have different hospitals at the lower levels, but if you have, some bigger problems, like for example, this is the center where we have the only care for cancer radiotherapy, or cardiac center for kids. So basically this hospital serves that whole population. And it's also affiliated with the university, so it's also where we go to medical school when you are in Addis Ababa University. This hospital, this part of the hospital, it was built around 50 years ago, and right now it has different brands, the newer versions of the building, but this is basically the oldest part, which was built around 50 years back. So in Ethiopia, you have this population, the rural part of the population, which consists around 85% of it. And because of that, you see lots of inequality in gender. When you don't see that a lot in the capital city or in the other cities that we have. And so you have basic statistics here. At the beginning, this was done in 2013, and you have 90% of children, 90% of girls going to primary school. And this drops to 35% by grade 9 and 10, and then only 7% of those, I can't see the red dot, okay. So only 7% of those at grade 11 and 12 are women. So you see a major drop taking place from the level of primary school to the level up to grade 11 and 12. And instead of telling you further statistics, I chose to share some stories with you. This is a story from Half the Sky, and this is a book that was written by a New York Times writer, and he is married to this American Asian woman, and they wrote this book together. And it's about the difficulties that women face throughout the world. And it has a story, two stories about Ethiopian girls. And the first one is a girl named Wainishet, which is quite similar. Her story is quite similar to what you see in the rural area. So children in the rural area, around the age of 14 or, 15, for example, they'd say a man wants to marry her. And usually the culture is a man is supposed to give some sort of gift for the parents in order to attain the woman. So if he doesn't have that, he can abduct her and rape her. And since virginity is given a big face in Ethiopia, if she's no longer virgin, then he can convince her parents to give her to him for free. So this is one of the stories that are common. And the other side of the story is, for example, a girl who has achieved to get up to the 8th grade, like which is the story for most, for most girls in Ethiopia. She gets married around the age of, let's say, 16, and she goes into labor. Her pregnancy was peaceful, but then her labor takes long. Usually, the women in Ethiopia give birth at their home. The delivery rate at hospitals is around 10%, and so if she let's say she went into labor she went into labor and it took 2 days at home, and then they finally decide that maybe we should take her to the hospital. So when she goes out, and then it might take 2 days to get to the nearest hospital. And so in the way, she develops fistula. And not only did she develop fistula, this particular lady, she also became paralyzed. And so after that, they decided to just keep her back home. And because of the fistula, she has, this sense that is coming out of her, and they didn't want her to be in their hut anymore. So they built this hut next to their house, and then they kept her there. And she was paralyzed, so she can't move around. And she became depressed, and she was sort of kept in this catatonic position for around 3 years. And finally, they decided that maybe we can take her to a hospital, and they took her to Fistula Hospital. And this is actually a success story where she was treated by the Fistula Hospital, the Catherine Hampton Hospital. And at that place, she was treated, and she had a colostomy done, and with vigorous physiotherapy, she was able to stand up and walk again. So it is actually a success story. I would recommend that you get this book. I mean, the story is not only in Ethiopia, but the others are also very interesting. When you come to the level of Addis Ababa University College of CHS, me and Hewitt, we just graduated just last year, and in our batch, it was 30% actually, the number of females. In the postgraduates, it was 15%. So there is a lot of success. I mean, the number of those people who go from higher education to college, to the medical college, has increased. And the exact figure is it has increased by 6-fold. But there is still, if you compare the men and the women, there is higher attrition, and there is also lower rate of graduation compared to men. And we have identified a lot of problems. And this is a paper which was published in the Ethiopian Medical Journal in 2015. And it shows clearly, it suggests some of the problems. And one of this is there is gender-based violence for around 30% of females in AAU-CHS. And this study was done for almost all faculty, for almost all female students. So there was a high response rate. So it suggests that it is 30% in AAU. But this story suggests that if you compare it to 75%, which is at the level of Ethiopia itself, it is lower for the medical school. But 30% is still pretty high. And if you go to the level of the faculty members, you see that it's 19.9% of female faculty. And I can show you a figure. The level of profession, in the upper parts, females are relatively more in number than males. But when you come to the lower part, lecturers, for example, 54 to 164. Assistant professor, 29 to 169. And if you come to the professor, then there is only one female professor compared to the 20 male. So as you go up the profession hierarchy, there is also lesser and lesser females. And also, we have around 33 medical schools in Ethiopia, and only Addis Ababa University has ever had a female dean, actually. And over the past 50 years, there has been 2 female deans. And if right now, this was some months back, so this is the department says 18. Currently, there are 23 departments, and we only have 2 department heads as females. This is the basic statistics. So Addis Ababa University, the College of Health Sciences, has gotten a grant. I wanted to show you. Has gotten a grant which is called MEPI. Not only Addis Ababa University, MEPI is a grant that was given by US, and this is for different medical schools in Africa, and as well as in Ethiopia, there are 4 medical schools which are taking part in this grant. And this grant, it also addresses gender equity, and another success story that we have is Addis Ababa University, MEP Ethiopia actually, all the 4 universities, are the ones who worked on gender equity rather than the other African the MEP units. So this is also one improvement, and through MEP there has been a lot of talk, and at least over the past 5 years there has been a lot of talk about increasing the number of female faculty, increasing bringing them up to leadership positions. So there has been a lot of intervention done, and out of these interventions, one is, first, there has been leadership fellowship, extensive leadership fellowships with Wisconsin. So that is one of the development leadership things that has been done. The second one is there has been lots of workshops conducted, and third, we have at least a baseline survey. The survey that I told you about, 30% is a result of that survey. So at least there is talk now about what has been done so far. And through these discussions, a gender action plan has been finalized. And this gender action plan, this gender equity action plan, the point is, MEPI is only a 5-year grant, and now I said it started in 2010, so it ends in 2015, this year. So the plan is for Addis Ababa University by itself, without the grant, in order to develop this action plan and to continue working on this action plan. So it has lots of components. It has 4 main components, and one is this policy that we're working on. It's one of the things that me and Hiwat are working on. And this policy, the main point is we don't have a specific sexual harassment policy, so it's in creating it as well as disseminating the information. We have other parts of the action plan as well. These are to enhance the gender office. There is gender office, but it's very weak. It doesn't have its own budget, and so it involves reactivating this gender office. It has other parts like, for example, establishing daycare center, better maternity policies for staff members. So these things are all included in the gender action plan, and there are raising awareness is part of it, and also conducting more research so that we know where we are and we know where we're going as a university. So the things that we have done so far, I told you a little bit about MEPI, and we have a draft of the policy, and it is being finalized. And we have tried to present this policy to the Senate. It has failed once, but so now the plan is, instead of working on it from the level of the university, we're working on it at the level of the school, since we have the support of the dean, and then we're planning to outgrow from the school to the college and then upwards to the university, so that we can be the start of change as a school of medicine. So the road ahead, we're very excited about this. It's to finish working on our policy, and to have it approved at the level of the dean for the school, and then we'll continue to advocate it, and it will be approved, hopefully, I'm sure, by the Addis Ababa University Senate. And this will continue, and we hope to get more partners from this QI as well as other places, and to continue working on the future action plans. We decided to work on the policy because if you've noticed, there are these asterisks that are there on each part, and these asterisks are actually the priority of students. So this idea came from the students themselves. The rest of the things are included under future plan. So after we've finished working on the asterisk parts, we will work on the rest of the gender action plan. And that is what we're trying to do, basically. Thank you.